Heart disease remains the leading cause of death in the United States, with 1 in 5 Americans dying from it. But a new cardiac CT scanner could be a game changer, as it gives more specific details than ever before. New tonight, I talked to 2 patients who thought they were in great shape, but they both received a shocking diagnosis.
Well, my father passed away at 48 of a heart attack. My mother passed away at 54 with bone cancer. So I got involved with trying to get myself psyched up, to try to beat the odds.
72-year-old Victor Giordano is definitely beating the odds despite those genetics. He exercises every day, lifts weights, takes spin classes, and mountain bikes over 30 miles on weekends, even competes.
There's mountain bike festivals all throughout the year, and Santos in Ocala State Forest is a 50-mile mountain bike ride, and I've done that several times.
Along with eating healthy, he thought his heart would be healthy too. His test results?
That I was like 60 to 70% clogged, and my widowmaker, one that goes down the middle, that was clogged as well, and that I needed to go on like a heavy statin to try to reverse that or to calcify that.
Eat fairly healthy and stayed active.
57-year-old Travis Wellman exercises and plays a lot of soccer. But due to being adopted, he was worried about his genetic history.
The actual adoption agency that I was adopted from by my parents burnt down, so all the records burnt with it.
So he wanted to check his heart condition, and despite no physical symptoms, his heart was 70% blocked.
It was very eye-opening because the location was a bad location to have an issue. So if something were to happen, it would have affected the majority of my heart muscle.
I can take this person has a lot of disease and I can get very aggressive with them and prevent them from having a heart attack.
Cardiologist Dr. Alberto Morales performed both men's tests at his office, South Tampa Cardiology, as he has one of the newest state-of-the-art CT scanners in the country. It takes over 550 pictures at every angle, with the help of medication to slow down a patient's heart rate.
And that pause allows us to take pictures to look at these tiny little arteries as if they're still. And what you need is a sophisticated camera like this Arineta SpotLight Duo. Super fast rotation speed, meaning it's like a sport camera on steroids.
The 3D images with contrast detects blockages in the coronary arteries and where plaque may exist. Dr. Morales showed us Travis's first CT scan with severe blockage, and 6 months later, after taking statins.
And you can see 6 months ago, he had a high-grade 70% proximal LAD. Most of this is dark, non-calcified soft plaque. About 6 months after therapy, it significantly reduced down to less than 50%.
Morales believes these in-depth results with AI make calcium scores no longer an accurate number alone to determine heart disease.
And if you have a calcium score and it's 0, your perception is you're good, but what I'm seeing is 40% of people with a 0 calcium score actually have coronary artery disease.
And he claims stress tests no longer reveal enough data as well.
70% of heart attacks today occur in non-obstructive plaques. These are plaques that don't block the blood flow. So even if you perform a stress test, it would be normal.
Since Vic received his results, he's been taking Repatha, a drug which helps lower cholesterol, and it's working.
So it dropped my cholesterol. My LDL was 140, I think, and it dropped it down to 70 within 3 months.
And with these recent results, Vic says he'll continue to live life to the fullest.
What it makes me feel like is that every day is really a gift. I mean, tomorrow's not guaranteed. So I try to make the best out of it, and that's really my philosophy.
And Travis is optimistic about the future as well.
Hopefully things can only get better, and we'll find out in 6 months how far we can push it down.
Some health insurance companies will pay for this new CT scan. You can also pay out of pocket, which runs anywhere from $500 to $700. We put more information on our website at abcactionnews.com/mental health.